This video is going to be all about overhead extension in athletes. As you can see from these clips, overhead extension in sports is a complex multi-joint movement requiring the coordination of the shoulder, shoulder blade, and the thoracic spine. In this video, we will be breaking down all the muscles that attach to the shoulder joint and their role in this complex movement. I'm starting our muscle breakdown with the rotator cuff muscle, the supraspinatus. The supraspinatus initiates the first 0 to 15 degrees of arm abduction. While the deltoid is the primary muscle for lifting the arm to and past shoulder height, it cannot lift the arm effectively from the resting position on its own. During overhead extension or elevation, it acts as a dynamic stabilizer. When you raise your arm overhead, the head of the humerus must remain perfectly centered in the socket so it doesn't scrape against the acromion, which is the bony tip of your shoulder blade. The supraspinatus acts as a vital depressor, actively pulling the humeral head downward to create necessary clearance during elevation. To put it in the most simple terms, the supraspinatus helps to lift the arm and stabilize the shoulder, so it is extremely important to overhead extension. Next, we have the infraspinatus muscle. The infraspinatus is a rotator cuff muscle, and it helps in two different phases for overhead extension. First, it helps during the wind-up. Before extending the arm backward and driving it forward, the infraspinatus externally rotates the shoulder. This action winds up the shoulder joint and preloads the tissue to generate maximum force. It also helps in the deceleration phase. The muscle contracts eccentrically to safely slow the rapid forward and upward movement of your arm. This prevents the upper arm bone from pulling up out of the socket and protects the joint from dislocation or labral tears. The infraspinatus also works as a stabilizer. As you lift or extend your arm overhead, the large deltoid muscle pulls the humeral head upward. The infraspinatus counters this by providing a downward compressive force to keep the joint aligned and prevent it from impinging against the bone. In simple terms, the infraspinatus turns the arm outward. It helps slow down your forward and upward movement, and it helps to stabilize the shoulder, which means this muscle is extremely important to overhead movement. Our next muscle is teres minor. It performs external rotation. As you raise and extend your arm, the teres minor rotates the upper arm bone outward. This crucial action creates safe clearance between your arm bone and the top of your shoulder blade, preventing painful pinching or impingement. The teres minor also helps in stabilization. The shoulder joint is inherently shallow. When you lift your arm, the teres minor compresses the head of the humerus into the shoulder socket, providing the stability needed to safely perform overhead movements. It will also help with extension and adduction. When working in synergy with other back muscles, the teres minor gently assists in extension and adduction to facilitate smooth overhead pulling and throwing motions. In simple terms, the teres minor turns your arm outward, it helps pull the arm backward, it helps bring the arm closer to the body, and it stabilizes the shoulder joint, which makes this muscle very important for overhead extension. Next, we have the subscapularis muscle. This is the last of the rotator cuff muscles. The subscapularis helps with rotational balance. The subscapularis is the primary internal rotator of the shoulder. During overhead extension or flexion, it acts as a crucial antagonist to the external rotators, like the infraspinatus. This constant push and pull keeps the shoulder joint perfectly aligned. It also helps with joint stabilization and depression. When you raise your arm overhead, the deltoid muscle tends to pull the humeral head upward. The subscapularis actively counters this by pulling the humeral head forward and depressing it, ensuring smooth mechanics. In simple terms, it turns the arm inward, it pulls the humerus head downward, and it works to stabilize the shoulder. Next, we have the deltoid muscle. The deltoid is a muscle in your upper arm. It has three distinct parts: the anterior, medial, and posterior. The anterior deltoid acts as a prime mover during vertical pushing motions and overhead throws. It also drives power in volleyball spikes and basketball jump shots. The middle deltoid performs shoulder abduction, and the posterior deltoid performs shoulder extension and external rotation. It controls the deceleration of the arm during high-velocity throws, preventing injury. It will also provide joint stabilization. The deltoid works as a force couple with the rotator cuff. During overhead sports, the deltoid pulls the humerus upward while the rotator cuff muscles pull downward to keep the joint centered in the socket. This dynamic coordination allows for a massive range of motion without causing shoulder impingement or dislocation. In simple terms, it does a lot. Because the muscle is on the front, middle, and back of the shoulder, we see it does a lot of different movements. It lifts the arm forward and upward, it lifts the arm out to the side, it turns the arm inward, it moves the arm backward, it turns the arm outward, and it acts as a stabilizer. Next, we have the teres major muscle. This is a small muscle in the upper back. It performs arm extension during overhead extensions, such as pulling down a cable or following through on a tennis serve. The teres major pulls the elevated arm downward and backward. It also helps with internal rotation in sports that require velocity, like baseball pitching or serving in volleyball. It works alongside the latissimus dorsi to internally rotate the arm at the shoulder. It will also help with adduction. It helps pull the arm towards the midline of the body, powering moves like swimming strokes or gymnastic moves. Finally, it will work with all the muscles in joint stabilization. While it is not officially a rotator cuff muscle, the teres major actively stabilizes this shoulder joint during powerful overhead movements. It helps prevent the humeral head from displacing when the arm is fully elevated. In simple terms, it pulls the arm backwards, it turns the arm inward, it helps pull the arm towards your body, and it works as a stabilizer. Next, we have the pectoralis major, or pec major for short. The pec major is a large muscle on the upper front of your chest. It is composed of two primary sections, both of which insert on the humerus. There's the clavicular head, which primarily assists in shoulder flexion, and the sternocostal head, which primarily assists in extending the arm from an overhead flexed position. During the deceleration phase, which is the extension from flexion, when you reach your arm back to wind up for an overhead throw, serve, or spike, the pectoralis major is stretched. As the arm is whipped forward, this muscle strongly contracts to extend and transversely adduct the humerus towards the midline. It will also perform internal medial rotation. While extending the arm, the pectoralis major simultaneously internally rotates. It will also act as a power generator. When it's acting within the kinetic chain, the pec major translates the torque generated by your legs and core into explosive distal power in the upper arm. In the simplest of terms, the upper pec assists to raise the arm forward, and the lower and middle pecs assist to bring it back down. They work together to move the arm across the body and turn the arm inward. And finally, they help move power from the legs and core to the arm. Next, we have the pectoralis minor muscle. The pec minor is a small muscle deep in the chest area. The pec minor helps with scapular stabilization. It anchors the shoulder blade to the rib cage, providing a stable base so that the large muscles of the arm and shoulder can produce forceful movements. It will also help in resisting elevation, an action called depression. In the cocking or preparation phase of a throw or serve, it counters excessive shoulder elevation, ensuring the shoulder blade remains in a safe downwardly tilted position. In simple terms, it stabilizes the scapula and it keeps the shoulder from over elevating. There it is, deep underneath that pec major muscle. Next, we have the latissimus dorsi muscle. The latissimus dorsi, or lat for short, is a large muscle on the back of the torso. It works on the shoulder joint by generating power and acceleration. When an athlete winds up to throw a baseball or spike a volleyball, their arm is brought into extreme flexion and abduction. In this fully stretched position, the upper region of the lats store elastic energy. As the athlete brings the arm forward, the lats contract violently to produce shoulder extension and internal rotation, delivering explosive power to a ball, racket, or stroke. It also helps with power transfer. The lats do not work in isolation. They are deeply connected to the core via the thoracolumbar fascia. This means they help channel power generated by lower body and core, transferring up through the torso and into the upper extremities. Like all the muscles on this list, it will help with the stabilization of the shoulder joint. During overhead actions, the lat hold the shoulder blades firmly against the rib cage, keeping the scapula from winging or shifting. This provides a stable, strong foundation for the smaller, more delicate rotator cuff muscles. In simple terms, the lat helps by bringing the arm backwards, turning the arm inward. It transfers power from the core to arms, and it stabilizes the shoulder joint. Next, we have the trapezius muscle. The trapezius, or trap for short, is a large upper back muscle that can be divided into 3 different sections with differing roles. The upper trap elevates the shoulder blade and assists in upward rotation during the initial and mid phases of arm elevation. The middle trap retracts the scapula. It is highly active during the cocking phase of a baseball pitch or the pulling phase of a swim stroke. It stabilizes the shoulder blade against the pulling forces of the chest muscle. The lower trap depresses the scapula and creates upward rotation and posterior tilt, opening up space in the shoulder joint. It acts as an anchor that prevents the shoulder blade from sagging or rotating improperly when the arm is raised. In simple terms, the upper trap shrugs the shoulders and helps upwardly rotate the shoulder blade. The middle trap brings the shoulder blades together towards the spine. The lower trap lowers the shoulders and assists in upward rotation of the shoulder blades. And it all helps to stabilize the shoulder. Next, we have the serratus anterior. The serratus anterior is a wing-like muscle near the lateral part of the back. It performs upward rotation. To lift your arm fully overhead, your scapula must rotate upward. The serratus anterior works closely with the trapezius to create a force couple, tilting and rotating the scapula so that the arm clears the joint safely without pinching the rotator cuff. It also performs scapular protraction. During the final phase of a serve, throw, or spike, the serratus anterior pulls the shoulder blade forward and wraps it around your rib cage. This maximizes your reach and extends your effective kinetic chain for optimal power and velocity. It will also help to stabilize. It prevents scapular winging, where the shoulder blade lifts away from the ribs. This keeps the arm securely anchored so you can safely bear heavy loads, push forward, or repeatedly swing. In simple terms, the serratus anterior performs upward rotation of the shoulder blade, it pushes forward the shoulder blade, and it provides stability to the shoulder joint. Next, we have the levator scapula. The levator scapula is a long muscle in the upper back and neck area. It will help with movement stabilization. As the arm reaches overhead and pulls back, the levator scapula works alongside the upper traps to stabilize the shoulder blade against the rib cage. This prevents unwanted winging and creates a solid, stable base. It will also help with the control of upward rotation. Overhead extension requires the scapula to upwardly rotate, allowing the arm to clear the shoulder joint safely. During this upward motion, the levator scapula often contracts eccentrically to act as a brake, ensuring the shoulder blade doesn't tilt or rotate too far. And then finally, it will also help with energy transfer. The muscle helps coordinate the force flowing from the lower body and core up through the spine and out to the shoulder. It supports the cervical spine, keeping the head stable while the arm whips through the overhead motion. In simple terms, it stabilizes the shoulder, it keeps the shoulder blade from over-rotating, and it transfers energy from spine to the shoulder. Next, we have the rhomboid muscles. The rhomboid is a small muscle in the upper back. It provides a stable anchor for movement through the retraction of the scapula. Before you can extend your arm forcefully overhead, your body needs a secure base. The rhomboids, along with the middle trap, retract the scapula. This retraction anchors the scapula, allowing the larger primary movers like the lats or the deltoids to transfer power efficiently. It also helps to decelerate the arm. During an explosive overhead movement like a tennis serve or baseball pitch, your arm rotates rapidly forward. After the ball or racket makes contact, the rhomboids engage eccentrically to act as a braking system. They prevent your arm and shoulder from wrenching forward out of joint and protecting the rotator cuff from injury. It will also help with maintaining posture and joint mechanics. Healthy, strong rhomboids are critical for maintaining upper body posture. If you frequently round your shoulders or slump your thoracic spine, it limits your range of motion and makes you significantly more prone to shoulder impingement when reaching overhead. proper rhomboid function ensures the shoulder blades can tilt and glide smoothly. In other words, the rhomboids help pull the scapula towards the spine, keep the arm from over-protracting, and keep the shoulders from rounding forward. Next, we have the subclavius muscle. The subclavius is a small muscle in the chest area. It works as an active stabilizer. During arm abduction and overhead extension, the clavicle naturally elevates and rotates backwards to allow full range of motion. The subclavius steadies this movement by anchoring the clavicle to the first rib. It will also help with kinetic regulation. Rather than acting as a primary driver, the muscle regulates the output of kinetic energy. It absorbs the heavy shock placed on the shoulder girdle during the deceleration phase. To put it simply, the subclavius helps with stabilization of the shoulder, and it is a shock absorber of movement. Next, we have the biceps brachii. The biceps brachii, or bicep for short, is a long two-headed muscle in the upper arm. In overhead motion, it helps with decelerating the arm. During an explosive movement, the arm extends at incredibly high velocities. Because the triceps is contracting to drive this extension, the biceps act as the antagonist. During the final phase of a throw or swing, the biceps contracts eccentrically to slow down the forearm extension. This braking mechanism prevents the elbow joint from hyperextending or snapping. The biceps also help with stabilizing the shoulder. During maximum extension and external rotation, the humeral head is subjected to massive torsional and compressive forces. The long head of the biceps brachii acts as an anterior stabilizer and helps depress the humeral head within the socket. This dynamic stability relieves stress on critical ligaments, such as the inferior glenohumeral ligament. It will also help protect the elbow in throwing and swinging sports. The inner elbow experiences a violent valgus force that attempts to hold the joint apart. The biceps correlates heavily with grip strength and works synergistically with the forearm flexors and pronators to create a protective net around the ulnar collateral ligament. To put it simply, the biceps protect the elbow when the arm is in overhead extension, it stabilizes the shoulder, and it helps to slow down the arm. Next, we have the triceps brachii. The triceps brachii, or triceps for short, is a muscle in the back of the arm. It helps with shoulder joint in overhead motion by generating power. The triceps drive the explosive lockout in sports that require extending the arm over the head, such as with a baseball or softball pitch, serving in tennis, or spiking in volleyball. They also help with deceleration. Because many overhead motions involve high-velocity follow-throughs, the triceps act as an antagonist to slow down the movement. This braking mechanism protects the elbow and shoulder joints from hyperextension and ligament damage. Like all the muscles here, the triceps help with shoulder stability. The long head of the tricep is biarticular, meaning it crosses both the elbow and the shoulder joint. During overhead motions, it aids in adducting and extending the arm at the shoulder and holding the humeral head securely in its socket to prevent joint location. Simply, it straightens the arm, it helps slow down arm movement, and it stabilizes the shoulder. Next, we have the coracobrachialis muscle. The coracobrachialis is a small muscle in the arm-chest area. It helps to keep the humeral head stabilized. During the backswing or rapid follow-through phase, this muscle is working alongside the deltoid and long head of the triceps to stabilize the humerus and the shoulder socket to prevent the joint from shifting out of place. It also helps with controlling extension and abduction. When your arm goes into full extension or is pulled backwards, as with a tennis serve or swimming stroke, the coracobrachialis acts as a powerful antagonist to the deltoid. It acts like a brake, preventing the shoulder from overextending or deviating incorrectly. It helps with internal rotation and adduction during the striking or throwing phase. To put it simply, the coracobrachialis stabilizes the shoulder, it prevents overextension, brings the arm inward towards the body, and helps rotate the arm inward. Now you know what all the muscles connecting to the shoulder joint do during overhead extension. Like I said earlier, overhead extension is a full body and complex movement. If you are an athlete in a sport that has you consistently performing overhead activities, or if you have clients who are in overhead sports, You must look at the full picture of movement. We cannot simply just hit what we think are the main muscles of a movement. The muscles work together in a system, which is why it's called the muscular system. In the shoulder joint alone, every muscle that is connected to the joint has a role to play in overhead extension, which means any one of the muscles could be causing dysfunction, or it could cause dysfunction in the future. We need to take the time to truly understand what is happening in our movements and what role each of the muscles are playing in that movement. That way, if we're trying to work on ourselves through self-care, we can work on the proper muscles for the proper reason. And if we're working on other athletes, we can do the same and hopefully keep their body working to the best of their ability.